division was the attempt to define areas of subspecialization versus the general field of obstetrics and gynecology, and to identify people or physicians who had the expertise, the experience to perform subspecialization, whether it be in maternal-fetal medicine, reproductive endocrinology, or the cancer area.
I thought individuals who were trained in general obstetrics and gynecology, that a significant number I was hoping, would want to go into that subspecialty, and so that there would be trainees available. And that's always a question, because after 4 years of medical school and then 4 years of residency, it could be that nobody wants to put in 2 or 3 more years. But what we had hoped for came true, and people did flock to the training programs. The training programs expanded, and we have a large number of very well-trained subspecialists now.
Well, the concerns a lot of people had is that, what are you going to do when you finish your fellowship? Are you going to take care of babies? And I would say, no, I'm going to hand them off to a neonatologist, and I'll let them take care of them.
Well, the initial concern was in terms of how well would it be accepted by the profession as well as by the patients. And it turned out that this was very well accepted, and I think provided a wonderful opportunity to really foster the subspecialty.
And I think the major breakdown would be regionalization of perinatal care. That's involved most of my life, and I think that has been a major breakthrough which really has helped the high-risk mother. Certainly ultrasound has been dramatically important about putting a face, so to speak, on the fetus more, and I think that's been a wonderful diagnostic parameter. Third, I think that advances in genetics and birth defects assessments and genetic counseling and genetic testing have been just amazingly dramatic over the last 40 years. I think those are the major contributing factors, I guess, leading up to the last one, which is intrauterine fetal and placental surgery. I mean, who would have imagined back when we first started this that we would be able to accomplish intrauterine fetal and care the way we've seen it evolve. So those are the major breakthroughs that at least I see from watching it over the 40 years.
Well, the legacy of the subspecialty is clear. We have worked hard as a profession to make safety safer for mothers and babies, to look at the broad outcomes of pregnancy in both the mother and the baby. In other words, just survival is not an endpoint. Healthy survival, productive life and productive survival of mother and baby is the outcome that we seek. So I think the specialty has pervaded all aspects of both mother and baby, risk and low risk, and how to teach the next generation.